Do you have adult ADHD and wonder which medication is going to be best for you? Well, I'd like to talk today about the different medications that are effective for many people with adult ADHD. And the way I often explain it to my patients is that there are really three classes of medications. There are the Ritalin type medications, and the ones in that class would include Ritalin, Focalin, Concerta. There are the medications that are in the amphetamine class of ADHD treatments, and that would include Vyvanse, Adderall, and mixed amphetamine salts. And then the third class of medications would be the non-stimulant medication that is Strattera, and this has also been FDA approved for adult ADHD. In my opinion, the most effective medication for adult ADHD typically are the stimulant medications. And so then one might ask, well, which stimulant medication do I use? From the research, stimulant medications are effective for people with adult ADHD in about 85 to 90% of the situations. Out of that group of people who tolerate it, their symptoms improve and they don't have side effects that are intolerable, about 50% of the people in this cohort will do well whether you give them a stimulant from the Ritalin type of medications or whether you give them a stimulant from the amphetamine or Adderall type medications. And what's interesting is that about 25% of patients where stimulants are effective, they will preferentially do better on the Ritalin or methylphenidate type medications, and about 25% of patients who do better with stimulants or who respond to stimulants will do better preferentially on the amphetamines. Now let me go back for a moment and just talk about why there's so many different names and what some of the different medications are in each of the different classes. Within the stimulant medication classes of Ritalin, or the generic name of it, which is methylphenidate, there are several preparations that are all Ritalin-based or methylphenidate-based, but have different release mechanisms and therefore different durations of time where they're effective. So for example, you have Ritalin immediate release, where the half-life is anywhere from 2 to 4 hours. You have Ritalin long-acting release, where the half-life is anywhere between 8 to 10 hours. And then you have Concerta, which has a much longer half-life, and the half-life can be anywhere between 10 and 12 hours. Now let's go to the amphetamine type medications and talk about some of the common ones that you may have come across. There is Adderall, and the generic for that is called mixed amphetamine salt, and that's an immediate release preparation where the half-life or the time of efficacy would be between 4 to 6 hours. There would be Adderall extended release, and the release mechanism for that and the half-life would give you benefit between 10 to 12 hours. And then you have another medication that is called Vyvanse, and that is another long-acting amphetamine, similar mechanism as to the Adderall and the Adderall long-acting. However, it has a much longer half-life of 12 hours, and some people find this medication smoother acting. In terms of the third class of medications, one of the reasons why I don't find this medication my top choice is that Strattera is very similar to an antidepressant, and it can have some side effects and tends to not be as effective in my clinical experience, as well as what the research says in terms of its benefits. I hope that you have found this video helpful. My name is Dr. Scott Shapiro, and I'm a psychiatrist who has been practicing in New York City for over 15 years. And if you have liked this video, please subscribe to this channel so you can see other informative videos. Thank you very much.